Occupational English test. Listening test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good morning. How can I help you today?
Hello, doctor. I've been experiencing really severe stomach pains for the past couple of weeks. It's gotten to the point where I can barely eat without feeling discomfort.
I'm sorry to hear that you're in pain. Can you describe the nature of these stomach pains? Are they sharp, dull, cramping?
It's a sharp pain, mainly around my upper abdomen. Sometimes it feels like a burning sensation.
Do these pains occur at any particular time, such as after eating or during the night?
Yes, they usually start soon after I eat, especially if I eat something fatty or greasy. I also notice that I feel a bit better when I drink water or eat something bland.
Have you experienced any other symptoms like nausea, vomiting, or changes in your bowel movements?
I have felt nauseous on several occasions, and my appetite has decreased a lot. I haven't vomited, but I feel like I might if I eat anything heavy.
Based on what you're describing, it sounds like it could be related to your gallbladder, possibly gallstones or inflammation. Have you had any issues with your gallbladder before?
Not that I know of, but my mother had her gallbladder removed because of gallstones a few years ago.
Given your symptoms and family history, it's important we look into this. Gallbladder issues are often hereditary. I recommend an ultrasound to examine your gallbladder for stones or other abnormalities.
How does that work? Is the procedure complicated?
It's a simple and non-invasive procedure. You lie on an exam table, and a technician will use a small device to take images of your gallbladder. It's painless and can be done in our facility.
What if they find gallstones?
If gallstones are indeed the cause, the treatment typically involves managing your diet to reduce symptoms, medication to possibly dissolve the stones, or surgery to remove the gallbladder if necessary.
Is surgery often required?
It depends on the severity of the symptoms and whether there are complications like inflammation or infection. Many people manage well with dietary changes and medication, but we can consider surgery if your quality of life is significantly affected.
What kind of dietary changes are we talking about?
You'd need to avoid high-fat and greasy foods, as these can trigger gallbladder attacks. Eating smaller, more frequent meals can also help.
And if it turns out to be something other than gallstones?
We'll approach that step by step. If the ultrasound doesn't show gallstones, we might need further tests, like a CT scan or MRI, to get a more detailed look at your abdominal area.
Okay, how soon can we do the ultrasound?
We can schedule it for this week. It's best to address this soon to alleviate your discomfort and avoid any potential complications.
Thank you, doctor. I appreciate your help. I've been worried about this pain.
You're welcome. It's important to address these issues early. I'll make sure we take good care of you and get to the bottom of this.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good afternoon, doctor.
Good afternoon. What brings you in today?
Well, I've been having some difficulty with my breathing getting worse over the past few months. It's like I can't catch my breath after even a small amount of physical activity.
I'm sorry to hear that. Have you noticed if this gets worse at certain times of the day or year or in particular environments?
It seems to get worse when I'm at work. I'm a carpenter, so I'm often around a lot of dust and wood particles.
That makes sense. Exposure to dust can exacerbate respiratory symptoms. Do you use any protective gear like masks?
I do wear a mask sometimes, but not always. I find it a bit cumbersome.
Understandable, though it might help reduce your symptoms. Have you had any wheezing, chest tightness, or had to use any medications for your breathing?
Yes, I've been using an inhaler more frequently. It helps, but I feel like I'm relying on it more than I used to.
Which inhaler are you using, and how often do you find yourself needing it?
It's a blue inhaler, salbutamol, I think. Lately it's been like twice a day or more.
Okay, that's quite frequent. Are you on any other treatments for your breathing, any long-term inhalers or medications?
I used to take something else a few years back, but I stopped. I can't recall the name.
All right, it might be beneficial to revisit long-term control medications. It sounds like you may have asthma that's not well controlled, which can worsen with exposure to irritants like sawdust.
Is there something we can do to get it under control? I can't afford to lose time at work.
Absolutely. We can optimize your treatment to help manage the symptoms better. We should consider restarting a combination inhaler that contains both a long-acting bronchodilator and a steroid. This will help reduce inflammation and keep your airways open.
Okay, that sounds good. What about immediate relief? Sometimes I feel really tight in the chest.
For immediate relief, continue using your salbutamol inhaler as needed. However, if you're using it more than twice a week, it's an indication that your asthma may not be under control. We need to address this with preventative measures as well.
I understand. What else can I do to help myself?
Avoiding triggers is crucial. Ensure you're wearing a mask consistently at work. It can significantly reduce the amount of irritants you inhale. Also, consider having an air purifier at home, especially in your bedroom.
Got it. Should I watch out for any side effects from the new inhaler?
Yes, there can be some side effects, like hoarseness and sometimes a mouth infection called thrush. To help prevent this, rinse your mouth after using the inhaler. We will schedule a follow-up in a few weeks to see how you are doing with the new medication and adjustments.
Thanks, doctor. I appreciate the help. I hope this makes a difference.
You're welcome. I'm here to support you. Let's aim for a significant improvement in your symptoms. Remember to schedule that follow-up appointment and call if you have any concerns before then.
Will do. See you next time, and thanks again.
Take care and see you soon.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
Good afternoon, Lisa. I wanted to discuss Mr. Thompson's case with you. He's been struggling with chronic back pain and is not responding well to his current pain management regimen.
Yes, I've reviewed his file. Chronic pain can be quite complex to manage. What treatments has he been trying so far?
He's been on a standard NSAID regimen and occasional opioids for acute flare-ups. I believe integrating a more holistic approach could enhance his quality of life. Perhaps introducing physical therapy and mindfulness practices could help.
Absolutely. I'll work with him on developing a personalized therapy plan, focusing on both physical and mental health components. We can introduce yoga and targeted physiotherapy exercises.
Great. With a more comprehensive approach, I believe we can achieve better outcomes for his pain management.
Now look at question 26.
Welcome, everyone, to today's seminar on advances in Alzheimer's disease treatment. Over the next 4 weeks, we'll explore the latest research and treatment strategies for managing this challenging condition.
That's right. This first week, we're going to look at new pharmacological advances and how they can be integrated into treatment plans. It's crucial we stay updated on these developments to offer the best care to our patients.
In our subsequent sessions, we'll discuss non-pharmacological interventions and support systems for patients and their families. Understanding the full spectrum of care is essential for effective management.
We'll also provide case studies and interactive discussions to better understand how these strategies are applied in real-world settings. Prepare for a comprehensive learning journey.
Now look at question 27.
I had a consultation yesterday with a patient who has just been diagnosed with celiac disease. She's worried about how to manage a gluten-free diet effectively.
That's a common concern. Did you talk about naturally gluten-free grains like quinoa and rice?
Yes, she's open to exploring those. She's especially concerned about cross-contamination in dining out, which can be tricky.
Absolutely. She should look for restaurants that are certified gluten-free and always communicate her needs clearly. Maybe suggest keeping a food diary to track her reactions and help identify safe foods.
Great idea. I think with thorough education and careful planning, she'll manage her new dietary needs well.
Definitely. It's all about adapting and learning what works best for her lifestyle.
Now look at question 28.
I've been monitoring a patient with early signs of hypertension. His family has a history of it, and he's keen on avoiding medications for now.
Lifestyle modifications can be very effective. Has he considered dietary changes, like reducing sodium intake and increasing potassium with fruits and vegetables?
Yes, he's willing to try that. He's also interested in other natural ways to manage his blood pressure. What else can we recommend?
Regular physical activity is crucial. Even moderate activities like walking or swimming can make a big difference. Stress management techniques like yoga or meditation could also help.
That sounds comprehensive. I'll suggest he starts with these adjustments and monitor his progress closely.
Perfect. Keeping a close eye on his blood pressure readings will help us know if these changes are enough or if more interventions are needed.
Now look at question 29.
Good afternoon, everyone. Today, I'd like to introduce how integrating technology can transform geriatric care. Our aim isn't just to manage symptoms, but to enhance the quality of life for our elderly patients.
Exactly. With the use of telemedicine, we can conduct remote checkups, which are particularly beneficial for those who have mobility issues or live in remote areas.
Absolutely, and let's not overlook wearable technology that monitors vital signs and detects falls. These devices ensure constant care and swift response in emergencies.
Indeed. It's also crucial that we train our staff to use these technologies effectively and with empathy. We must keep our care patient-centered, ensuring that technology complements rather than complicates their lives.
Now look at question 30.
How's the clinic been today?
Quite hectic, but it's really highlighted the mental strain our healthcare workers face. I had a nurse breakdown due to the overwhelming pressure.
That's tough. It's a reminder of how critical it is to support the mental health of our staff. Without their well-being, we can't provide the best care to our patients.
Exactly. It makes me think we should perhaps introduce regular mental health workshops and maybe even counseling services for our team.
I completely agree. Creating a supportive environment not only helps our staff cope, but also sets a standard for how care should be approached holistically. Let's propose this to the management.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1.
Greetings, I'm Dr. Maya Robertson from the Neurological Research Institute. Today we're delving into a critical and increasingly prevalent issue in healthcare, Alzheimer's disease. Alzheimer's disease, a progressive neurological disorder that primarily affects the elderly, is the most common form of dementia. It involves the deterioration of cognitive functions, affecting memory, thinking skills, and the ability to perform everyday activities. Despite its prevalence, Alzheimer's remains a challenging puzzle in the medical community. According to the latest data from Alzheimer's Disease International, nearly 50 million people worldwide suffer from dementia, with Alzheimer's accounting for approximately 60 to 70% of these cases. These figures are projected to triple by 2050, highlighting an urgent need for comprehensive strategies in dealing with the disease. Alzheimer's is characterized by the accumulation of amyloid plaques and tau tangles in the brain, which disrupt cell function and trigger neuronal loss. Symptoms typically develop slowly and worsen over time, becoming severe enough to interfere with daily tasks. Initially, patients may experience mild confusion and difficulty remembering recent events. But as the disease progresses, they often suffer from severe memory loss and lose the ability to carry out the simplest activities. The path to diagnosing Alzheimer's is complex, involving a combination of clinical examination, neuroimaging, and cognitive testing. Unfortunately, like many other diseases, Alzheimer's can be misdiagnosed or overlooked as part of normal aging, especially in its early stages. This highlights the need for increased awareness and better diagnostic tools. Risk factors for Alzheimer's include age, genetic predisposition, cardiovascular disease, and lifestyle factors such as diet and exercise. While aging and genetics are non-modifiable risks, lifestyle factors offer a window for intervention that could potentially delay the onset or progression of the disease. The emotional and psychological impact of Alzheimer's on patients and their families cannot be overstated. As the disease progresses, the loss of independence and memories can be devastating, leading to emotional distress and financial burdens due to long-term care needs. In terms of treatment, there is no cure for Alzheimer's, but there are medications available that can help manage symptoms, although their effectiveness can vary. Recent advances in research have been promising, with new drugs aimed at slowing the progression of the disease and improving the quality of life for patients. Moreover, research into Alzheimer's disease is robust, focusing on developing better diagnostic tools, understanding the molecular mechanisms of the disease, and finding effective treatment strategies. One of the most promising areas of research is the development of biomarkers that can detect the disease in its earliest stages before significant brain damage occurs. Preventative strategies are also critical. Public health initiatives that promote a healthy lifestyle, regular physical activity, and a balanced diet are essential, as these can potentially reduce the risk of developing Alzheimer's. Furthermore, educational programs that inform the public about the signs and symptoms of Alzheimer's are crucial in fostering earlier detection and treatment. As healthcare professionals, researchers, and community members, we must prioritize the fight against Alzheimer's. By enhancing research funding, improving care strategies, and fostering a supportive community, we can make significant strides in addressing this formidable challenge. The journey is long, but with sustained effort and collaboration, we can hope to make a difference in the lives of those affected by Alzheimer's disease.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Good day to all. I am Dr. Jonathan Green, and I specialize in endocrinology with a focus on diabetes management. Today, I will be discussing an increasingly important issue in healthcare, particularly relevant to our aging population, the intersection of diabetes and cardiovascular disease. Diabetes is a well-known risk factor for cardiovascular disease, which remains the leading cause of death globally. However, what is often underappreciated is the bidirectional relationship between these two conditions. Not only does diabetes increase the risk for cardiovascular disease, but cardiovascular disease can exacerbate the complications associated with diabetes, creating a cycle that can significantly impact patient outcomes. One of the critical points I want to emphasize today is the importance of early intervention and comprehensive management strategies. For individuals with diabetes, particularly type 2, the risk of developing cardiovascular diseases such as coronary artery disease, heart attack, and stroke is significantly higher. This risk increases as the person ages or if the diabetes is poorly managed. Furthermore, hypertension, which is commonly seen in diabetic patients, further compounds this risk. Managing diabetes in a way that also mitigates cardiovascular risk involves several key strategies. First and foremost is the control of blood glucose levels. Maintaining a HbA1c level below 7% is generally recommended, but this may vary based on individual patient factors. It's crucial that each patient's treatment plan is tailored to their specific needs, taking into account their overall health, risk factors, and lifestyle. Another major component is lifestyle management, which includes diet, exercise, and weight control. A heart-healthy diet, low in saturated fats and high in fruits and vegetables, can help manage both diabetes and reduce cardiovascular risk. Regular physical activity not only helps regulate blood sugar levels, but also improves heart health. Moreover, medications play a pivotal role. Beyond insulin and other glucose-lowering agents, drugs that have shown cardiovascular benefits in diabetic patients, such as SGLT2 inhibitors and GLP-1 receptor agonists, should be considered. These medications not only help control diabetes, but also provide protective benefits against heart disease. Screening and regular monitoring are also vital. This includes regular checkups that monitor blood pressure, lipid levels, and kidney function, all of which are crucial for preventing cardiovascular complications in diabetic patients. Patient education is another cornerstone of effective management. Educating patients about the symptoms of cardiovascular disease and the importance of regular monitoring can empower them to seek help early when interventions are most effective. Finally, collaborative care models involving a team of healthcare providers, including endocrinologists, cardiologists, dietitians, and diabetes educators, are essential. This team approach ensures that all aspects of a patient's health are addressed, which is crucial for managing complex interrelated conditions like diabetes and cardiovascular disease. While the link between diabetes and cardiovascular disease poses significant health challenges, especially as our population ages, it also provides an opportunity for targeted interventions. By focusing on comprehensive and preventive care, we can significantly improve the quality of life for patients with diabetes and reduce their risk of cardiovascular complications. This holistic approach is not just about managing numbers, but enhancing the health and well-being of individuals across their lifespan.